Now in this segment, we're going to cover adult CPR. Now this is about an 18-year-old male. Witnesses say that he was playing basketball when suddenly he started to lose his balance. He clutched his chest and collapsed to the floor and was not responsive. We find him on the floor the same way they described it. Now, before we get into actually doing the CPR skills, we still want to make sure that the scene is safe. He did not step on an electric cord. There were no gases in the area that made him collapse. Once we can be sure that the scene is safe, we make sure our gloves are on, our CPR shield with a one-way valve is available, and now we can begin with our taps and shouts. So we tap and shout on the collarbone. Sir, are you all right? Are you okay? He does not respond to our taps and shouts, and he's not apparently breathing normally at all. So we're going to go ahead and activate EMS. You in the plaid shirt, go call 911 and come back. If you see an AED, please bring it back with you. If there's nobody to go call 911 for you and you have a cell phone, dial 911, hit the speakerphone button and leave it on so that the dispatcher can coach you through the CPR along the way. But now, because we know he's unresponsive, not breathing normally, I'm going to go straight into my CPR compressions. A few pieces to note here when we talk about the chest compressions. The landmark we're looking for to do chest compressions is the first palm between the center of the chest, between the nipple line on the lower third of the sternum. We want to be sure to interlock our top hand over the first hand, keeping our elbows locked and leaning over the patient. We want to use our upper body weight to help us do that consistent chest compression for a longer period of time than if we're trying to use our upper body strength. The second piece of that, when we do our full 2 to 2.4 inch deep compression, we want to make sure that we come all the way back up and allow the chest to fully recoil before we give our second, third, and consecutive chest compression. The rate by which we're going to do these chest compressions is between 100 and 120 times per minute. That means we're going to be delivering at least 2 chest compressions every second. And this is what it looks like. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9, 10, 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now I'm going to do a head tilt chin lift. I'm going to cover his nose and mouth with my mask, pinching his nose, opening his mouth. Now I deliver 2 rescue breaths. Now I know the 2 breaths went in because I saw a good chest rise and fall. Now I'm going straight back into my 32 inch to 2.4 inch deep compressions at a rate of 100 to 120 times. 2 and 3 and 4 and 5 and 6 and 7 and 8 and 10 and so on up to 30, followed by 2 more rescue breaths. And we're going to continue this 30 compressions to 2 rescue breaths until EMS arrives, until an AED arrives on scene, or until the patient starts to respond and breathe normally.